Dave, speaking of education, I know Aviv has as kind of that's its core to help educate the people that come in through those doors as well as the community. Could you speak a little bit about that in classes you have, ways you educate the people around?
Yeah, I mean, it has evolved. I would even go as far as to say that Dr. Elamir and his clinical team spend a third of their time just educating the community. CME events for physicians and the healthcare community, seminars, conversations, even the one-on-one consults that Mo has are very educational. There's two different forms. One, Mo did a great job of articulating some of the barriers we're encountering in the healthcare community, but even in society, we have a society that is very much a quick fix society when it comes to their own body, in addition to every other aspect of life. Our bodies didn't break down in a couple of days. It's decades of deterioration and microvascular changes that have led to this cognitive decline. It's going to take a couple of months to heal it and see that rejuvenation. And so, when we're trying to educate a society that is looking for a pill, looking for a quick fix, compounded by the fact that they're expecting insurance to cover everything, puts us in a difficult position in a dichotomy that is changing. I do believe the pandemic has really brought the importance of one's health and wellness to the forefront as a priority in many of our society. But we still have a long ways to go. And I think the U.S., really, when it comes to health and wellness, trails a lot of other countries in just how their societies look at this.
Yeah, it's definitely, listen, I know from my side of it as well in the integrative field that it's difficult to change minds and belief systems. And I still do think that most people are in the traditional sense in a belief system that conventional medicine will save me. That regardless of what I do to my body, how poorly I eat, all the stress, everything else that by now we know is not good for us. Let's not, try and say, oh, I didn't know that, eating McDonald's daily and smoking cigarettes is bad. No, you can't use that one, but you can there is a pill for it. There is a surgery for it. And unfortunately, I think there needs to be this big differentiating factor of managing disease versus actually healing and restoring health. And that's what you guys focus on. That's what we focus on. And it's a total different approach. It's not the short term pop a pill for any ill and those symptoms go away, but you're still sick, really. You stop popping those pills and you'll see what happens. And that's where I think people need to change and embrace that long-term approach and really start to focus on the greatest wealth. Because I'm sure you ask any one of the patients that walk in Aviv that don't have the capacity to use their brain properly, they'd give up anything to have that back. They would pay any amount to have that back.